Today we are going to discuss the topic screening methods for antidiabetic agents. Myself Dr. Dipti Bandavne, working as professor of Department of Pharmacology at Progressive Education Society's Modern College of Pharmacy, Nigadi, Pune. In this session we are going to see what is diabetes, what are its different types in short, and then in detail screening methods for evaluation of antidiabetic drugs. Diabetes mellitus is a chronic metabolic disorder characterized by high blood glucose level. It is caused either by insulin deficiency or insulin resistance or by both. It affects the metabolism of carbohydrate, protein, fats, also affect water and electrolyte imbalance. Long-term diabetes affects cardiovascular system, eye, kidney and central nervous system. Diabetes mellitus is categorized in two types depending on presence or absence of insulin. Type 1 diabetes, also called as insulin-dependent diabetes mellitus, it is characterized by complete destruction of pancreatic beta cells. So there is no circulating insulin in those patients and therefore insulin is necessary for treatment of type 1 diabetes mellitus. Type 2 diabetes mellitus is characterized by insulin resistance, that is pancreatic beta cells secrete insulin. So insulin is there in the blood circulation. It may be low, it may be normal, but that insulin is not able to act on the target tissues and therefore blood glucose level increases. So for type 2 diabetes mellitus, oral hypoglycemic agents can be used including sulfonylureas, meglitinide, thiazolidinediones, etc. Screening methods for antidiabetic drugs are categorized in two types, in vivo models and in vitro methods. In vivo models include chemically induced diabetes, where different chemicals are used as diabetogenic agents, hormonal induced diabetes, virus induced diabetes, surgical methods, that is partial or complete pancreatomy, and genetic models. In vitro methods include fructose 2,6 biphosphate production in rat hepatocytes, inhibition of alpha amylase, and inhibition of alpha glucosidase. We will have a discussion now one by one regarding each method. In chemically induced diabetes model, as the method indicates, chemicals are used for induction of diabetes. Commonly used chemicals are Alloxan and Streptozotocin. They are the diabetogenic agents. Both of them causes destruction of pancreatic beta cells. The destruction is associated with extensive release of insulin. Initially, that insulin tries to reduce the blood glucose level, but as the load goes on increasing, it causes necrosis of pancreatic beta cells. Therefore, blood glucose level starts rising, and in these animals, after inducing the diabetes, the fasting blood glucose becomes more than 200 mg per deciliter. Further, these diabetic rats show classical sign of human diabetes including hyperglycemia, glycosuria, polydipsia, polyuria, and loss in body weight. In experimental pharmacology, Alloxan is commonly used to induce type 1 diabetes mellitus. It is because of its specific mechanism of action. Alloxan and its reduction form dialluric acid forms a redox cycle with the formation of superoxide radical. Once the superoxide radical is formed, it leads to formation of hydrogen peroxide, which is a reactive oxygen species. There is massive increase in cytosolic calcium concentration. This rise in calcium concentration produces rapid destruction of pancreatic beta cells, and this leads to type 1 diabetes in experimental animals. Alloxan induces diabetes in various experimental animals including rats, mice, dogs, rabbits, sheep, monkeys. However, it is observed that beta cells of rats are found to be more susceptible and sensitive to Alloxan as compared to mice and humans. Hence, in experimental study, commonly used animal is rats followed by mice for studying Alloxan-induced diabetes. Range of Alloxan dose is narrow and slight overdosing may lead to toxicity and mortality. However, the range differs from animal to animal as well as it differs according to route of administration. Once Alloxan is injected in experimental animals, it shows characteristic triphasic response. The first phase after administration occurs within 5 to 6 hours. It shows moderate hyperglycemia. because of destruction of pancreatic beta cells. However, the compensatory mechanism by the animal shows the second phase where increase in secretion of insulin will take place, and that will cause hypoglycemia in animals, and that leads to hypoglycemic death of some of the animals. Once this hypoglycemic phase is over, that means the compensatory mechanism will be completed. Then it will be followed by third phase of persistent hyperglycemia, which will occur after 36 to 48 hours of injection of Alloxan. Dosage of Alloxan differs for different species, as well as it changes as per the route of administration of the drug. The most frequently used dose of Alloxan is by intravenous route, and it is 65 mg per kg. However, if Alloxan has to be administered intraperitoneally or subcutaneously, that dose will be ineffective or insufficient, so the dose should be higher. It can be 150 mg per kg for intraperitoneal route. If it has to be in mice, then the dose becomes 100 to 200 mg per kg by intravenous route. So while performing the screening procedure, Alloxan is injected. After 72 hours of Alloxan injection, fasting blood glucose level of all the animals is tested. Those animals showing fasting blood glucose level more than 200 mg per deciliter are considered as diabetic, and they are further taken for next study. Hypoglycemic drug or antidiabetic drug is administered to those animals, and then again blood glucose level is determined to see whether the test compound has antidiabetic activity or not. Evaluation parameter is obviously fasting blood glucose determination. Besides Alloxan, streptozotocin is widely used for induction of diabetes in experimental animals. It is rather preferable over Alloxan, as the rate of mortality shown by animals is less in streptozotocin as compared to Alloxan. Also, Alloxan was only used for induction of type 1 diabetes. Streptozotocin can be used for induction of both, that is type 1 and type 2 diabetes mellitus, depending on the dose used in the experimental procedure. Now, how it produces diabetes or induces diabetes in animals? When streptozotocin is given or injected, it is selectively accumulated in pancreatic beta cells via glucose transporter in the plasma membrane, particularly GLUT2. Once it is accumulated in pancreatic beta cells, it causes alkylation of DNA and thereby causes damage to DNA, particularly regarding the DNA fragmentation. As an compensatory mechanism, the body will try to reduce this damage to DNA by increasing the level of poly-ADP ribose polymerase, that is PARP. This causes depletion of NAD+ and ATP stores in the body. This depletion of cellular energy stores finally results in beta cell necrosis, leading to diabetes mellitus. Similar to Alloxan, streptozotocin also exhibits triphasic response, that is first phase of mild hyperglycemia, second phase of hypoglycemic death in animals, and third phase of persistent hyperglycemia. However, the rate of death of animals in second phase is less as compared to Alloxan. While doing the experimental design, male vista rats are selected. Streptozotocin is dissolved in citrophosphate buffer having pH 4.3. The solution should be made fresh, and streptozotocin injected either intraperitoneal route or by IV route. After the injection of streptozotocin, after 72 hours of the injection, animals exhibiting fasting blood glucose level more than 200 mg per deciliter are considered as diabetic, and they are taken for the further study. In the further study, the antidiabetic drug is administered, and again fasting blood glucose level is determined as an evaluation parameter. Here it should be noted that in streptozotocin induced diabetic model, besides hyperglycemia, the animals show signs like glucosuria and decreased body weight, as in human diabetes observed. In experimental pharmacology, slight modifications in the model of streptozotocin induced diabetes as discussed has been carried out, and the models are as shown here. First is STZ nicotinamide model. Here the basic criteria is addition of nicotinamide causes partial destruction of pancreatic beta cells rather than complete destruction. So this model is mainly useful to the researchers who are doing the research in diabetes, particularly type 2 diabetes mellitus. Another model is STZ model in neonates. Here the principle used is STZ is given to the neonates after 2 to 3 days of their birth, and then it was continued for a particular period. It is found that when the neonates become adult rats, in that case the stable diabetes researcher can get, and he can study the various antidiabetic drugs. Third model is high fat diet low dose STZ model. This model is basically used nowadays for induction of diabetes along with induction of metabolic disorder. In hormone-induced diabetes model, insulin antibodies are used to induce diabetes. The principle behind this method is insulin antibodies neutralize endogenous insulin in rat and increases blood glucose level, which can be determined afterwards. Here, this method involves two steps. First, production of insulin antibodies, and second, injection of those insulin antibodies to the particular animal. So two species of animals are used, guinea pigs and rats. Guinea pigs are used for production of insulin antibodies, and those insulin antibodies then given to rats. For production of insulin antibodies, bovine insulin is dissolved in acidified water of pH 3 and is incorporated in water oil emulsion. 1 mg of this insulin is injected in guinea pigs in divided doses by subcutaneous route at monthly interval. Guinea pigs are sacrificed by cardiac puncture after second month. Insulin antibodies are then collected as serum, and IV injection of these insulin antibodies are given to rats in the dose of 0.25 to 1 ml. Evaluation parameter include measurement of blood glucose and blood insulin level. It is observed that the animals are considered as diabetic. They show fasting blood glucose level as high as 300 mg%. Corticosteroid and growth hormones can be used for induction of diabetes. In corticosteroid-induced diabetic model, rats are treated with hydrocortisone and they show hyperglycemia and glycosuria. Similar conditions can be produced in guinea pigs and rabbits also. In growth hormone-induced diabetic model, growth hormone, when repeatedly administered to adult dogs and cat, is observed that it induces diabetes. An intensive diabetic condition is produced in this model with all symptoms of diabetes including severe ketonemia and ketonuria. However, rats, if given hormonal treatment, do not become diabetic but grow faster and show striking hypertrophy of the pancreatic islets, and this becomes the limitation of this method. Hypoglycemic seizures in mice is a method used to test antidiabetic compounds. Here the principle involved is increased level of insulin result in hypoglycemic seizures and convulsions, and that can be measured. This is different than other methods because in all other methods of screening for antidiabetic compounds, the basic parameter used is primary therapeutic effect of antidiabetic drug, that is reduction in blood glucose level. This is the only method where rather than giving importance to primary therapeutic effect, secondary therapeutic effect is considered as an important aspect. The secondary therapeutic measure means because of reduction in blood glucose level, hypoglycemia arises, and that hypoglycemia induces seizures in mice. So animal used for this method is mice. Here in experimental design, the mice are selected. They are divided in two groups, standard and test group. Insulin, standard insulin and test compound is given by subcutaneous route to both the groups. Then the mice are observed for 1.5 hours in observation cages. Evaluation parameter include recording of number of mice that are dead or those mice that are showing convulsions or lie still for more than 2 to 3 seconds when placed on their backs. The percent of such mice is calculated and relative potency of test solution is found out. In genetic models of diabetes, no external agent is administered to animals for induction of diabetes. Rather, They are made genetically diabetic by autoimmune destruction of their pancreatic beta cells that result in insulin deficiency diabetes. Various animals, as mentioned over here, they are used as genetic model of diabetes. Here, it is observed that after the age of 2 to 3 months, the clinical diabetes occur, indicating the symptoms like hypoglycemia, hypoinsulinemia, and ketosis. Test drug is given and blood glucose level is determined. Type 1 diabetes may be due to virus infection and beta cell specific autoimmunity. D variant of encephalomyocarditis virus selectively infects and destroys beta cells in mice, similar to human type 1 diabetes. Also, diabetes can be induced by surgical method by complete removal of the pancreas. Diabetes by this method can be induced in animals like dogs and cats by total pancreectomy. Diabetes after complete removal of pancreas is severe in nature from first day till death of the animal. Generally, smaller animals like rats and mice are not suitable for this procedure. However, this method has number of limitations. High level of technical expertise and adequate surgical room environment is needed. There is high risk of infection as major surgery is involved. Adequate post-operative analgesia and antibiotic administration is necessary in this method. And there is loss of compensatory response by pancreas to hypoglycemia. Till now, we have discussed various in vivo methods for screening of antidiabetic drugs. Now, we will have a look at different in vitro methods available for screening that include fructose 2,6 biphosphate production in rat hepatocytes, inhibition of alpha amylase enzyme, and inhibition of alpha glucosidase enzyme. The first in vitro method, that is fructose 2,6 biphosphate production in rat hepatocytes, is based on the principle that antidiabetic drugs stimulate production of fructose 2,6 biphosphate in rats. In this procedure, rat hepatocyte suspension is taken. It is pre-perfused with 10 millimolar buffer solution for 30 minutes. It is centrifuged at 40 degrees Celsius for 15 seconds. The supernatant is removed and various concentrations of sulfonylureas are added. Evaluation parameter is DRCs of fructose 2,6 biphosphate content of isolated hepatocytes after addition of various concentrations of test and standard drug. Antidiabetic activity can be determined by studying inhibition of enzyme alpha amylase. It is a polysaccharide degrading enzyme. It is based on the principle that alpha amylase activity can be measured by determination of the reducing groups arising from hydrolysis of soluble starch. In this, pancreatic alpha amylase solution is taken. Various concentrations of alpha amylase inhibitors are added to it. Enzymatic reaction is started by addition of 1 ml soluble starch. The reaction is stopped after 10 minutes with 1 ml dinitrosalicylic acid reagent. The mixture is heated in boiling water bath for 10 minutes. Absorbance is measured at 546 nanometer. The antidiabetic activity is evaluated in terms of measurement of DRC of enzyme inhibition. This method is based on the principle that inhibition of glucosidase can be measured in vitro using glucosidase from small intestinal mucosa. In this method, glucosidase is prepared from rat or porcine small intestinal mucosa or porcine pancreas. It is incubated with 500 ml of sodium phosphate buffer and 20 ml of the solution is added with different concentration of glucosidase inhibitor at 37 degrees Celsius. The reaction mixture is heated for 2 minutes in a boiling water bath to stop the reaction. Glucose liberated glucosidase is measured by glucose oxidase method and IC50 of enzyme inhibition is determined. In today's session, we have discussed what do you mean by diabetes, what are its major two types, and then in detail screening methods used for evaluation of anti-diabetic compounds. Thank you.